study. We have a case study about 55 years old lady. We're going to talk about the process of diagnosis and the treatment, and finally the side effect of Parkinson disease. Our lady is, as I told you, is 55 years old. She started to suffer from stiff and slight tremor in her limbs. Then she visited her GP, who knows that she suffered from shuffle step while she walked. He referred her to MRI scan to do a provisional diagnosis for Parkinson's. Then he just booked an appointment for SPET and PET scans. So before we start with diagnosis, let's see what is Parkinson's disease. It is a neurodegenerative disease that affects about 1% of elderly people. It comes second after Alzheimer, actually. The main defect is a problem with the dopaminergic system. Even there is some neurotransmitter systems defect, like cholinergic or serotonergic or noradrenergic, but the main one is dopaminergic. Because if we have a look here, dopaminergic pathways control variety of function for the body, but of course the main one which we are interested in is the motor dysfunction, which is the main characteristics for patients with Parkinson's disease. They show a tremor with their limbs and some weakness or muscle defect. The main problem with dopaminergic in Parkinson here in the nigrostriatal region, which we will focus on it when we start with when we talk about the diagnostic techniques for Parkinson's disease. And this is another cartoon for showing the nigrostriatal pathway. For diagnosis, we have two types of diagnosis: the clinical diagnosis to see the signs and symptoms, and we have a technique to diagnose Parkinson. For the clinical, for our lady, she suffered from tremors and short shuffling steps. There is another signs like saliva trolling or muscle rigidity or bradykinesia. But the clinical finding is not enough. Only we need to do some MRI and SPET and PET techniques. For MRI, they use it for initial diagnosis, because we will talk about that later on, why it's not the final diagnosis technique. Overall, the molecular base of MRI working is depend on the measuring the correlation between water and fat ratio in the tissues, and if there is atrophy in the tissue, we will see that there is a defect between that correlation between water and fat. So it's depend on detect of the atrophy level in substantia nigra region by this technique, T2 weighted thin section images. But as I told you, it's not sufficiently sensitive enough to be the final techniques, because sometimes we have some circumstances like multiple sclerosis where a high level of atrophy is also present. So we need more specific technique. Like here is a picture for MRI images before we go for SPET. Here we can see that the nigrostriatal region, there is some defect with there is a high level of atrophy in this region, while here in the normal control there is no such defect. There is another two techniques: positron emission tomography, which is abbreviated by PET, and there is a single photon emission tomography, which is abbreviated by SPET. Both of them works by the same concept, by use of radio tracer, which is uptaken by the tissue. Then it starts to emit radiation, which can be detected by instrument. There is some defect between them. We will discuss that, why the doctor asked for doing both of those techniques, even they are doing the same job. For PET, they use something named fluoride 18 or they name it is F-DOPA, and for SPET they use iodide 123 as a radio tracer. Actually, when I tried to look what is the difference between them, there was some technical differences, but the concept is the same. But the difference we are interested in here, it's about that SPET is more accurate and more sensitive, while SPET is poorer sensitive. But why we need it? Because it can target some specific region in nigrostriatal region. So I think the doctor want to have comprehensive image. One of them is, one side is more specific and more accurate, and one side for SPET is can get image with high targeting for some regions. Then the neurologist diagnosed that this lady suffered from early stage of Parkinson's disease. So they start to give her initial dose of cabergoline and selegiline. As my colleague here will start to talk about the treatment of Parkinson's disease. Here is an image, show you image taken by PET actually for a patient, for SPET, sorry. Here we can see that the uptaking of the radio tracer is normally in both sides of the brain, while here for this patient with Parkinson there is a high radiation from this area, which shows us that there is a defect. If we come back here, there is a defect over here in this region, dopamine pathway region. So we can see here that the uptaking of the radio tracer by this tissue is higher than normal. These radio tracer actually, if we talk on molecular level, they work by uptaking by the damages cell, like we talk here about dopaminergic terminals, which is highly damaged during the Parkinson's disease. But this is not the only things that these techniques can do. They also can measure or investigate the distribution of dopaminergic receptor outside this nigrostriatal region. But this was shown only in the advanced stage, only not in the early stage. In the early stage, we will not see a high level of damage for this receptor. Sorry. Also, they see that this technique can measure the damage in other neurotransmitter systems, like serotonergic or cholinergic or noradrenergic system, because all of them are involved in Parkinson's disease actually. But as we say, the main one is the dopaminergic system. Recently, I saw some studies about involvement of extrastriatal damages. Like here, there is some study about involvement of autonomic nervous system in heart. They also see that there is some damage in the dopaminergic system in these regions. Here, this is a SPET image taken to sympathetic nerve in the heart. They see there is some damage for dopaminergic supplement for this region, and that's why we can see with Parkinson's disease there is some involvement of systemic damages. That's all for the diagnosis. Then now we will talk about the treatment of Parkinson's disease.